Hi guys, Dr. Chellam and Marina for our Wednesday afternoon podcast. I hope everyone is doing well. And today is going to be a very interesting topic, which I like to talk about. And usually that's one of the biggest challenges in functional medicine is to hone in on the patient's story. How is a functional medical doctor different? And this is what we try to look at in a functional medical approach. And as most people who usually join us for the podcast are quite familiar with our practice, the practice of functional medicine is getting to the root cause of why you have a symptom or a disease process. But before we even get to the root cause, what helps us understand what kind of testing do people need in order to get to their root cause? And that's where the first half of your visit with a functional medical doctor comes, which is called your story. And what does your story mean? A couple of things. When people come, I'll give you an example of a typical patient who would come to a functional medical doctor. They may have multiple issues, but they're all annoying issues, nothing that's killing them, right? Mm-hmm. They would have migraine headaches, they would have weight gain, they might have anxiety and depression, they may have hair loss, they may have a lot of joint pains, a lot of fatigue. And how do you get to figure out where does all this come from? And this is where we ask what we look at the patient's story. We gather information, organize it, and then retell the story to the patient. So what is important in a story is we all have a journey to whether it be illness or wellness. And that initial journey begins with what we call triggering events. So what is a triggering event? For instance, if you were born premature, that is a triggering event. That's a very stressful, as it is, childbirth is a very stressful event, both for the child and the mother. And then if the child is born premature, not ready to live in this world fully on its own, then that becomes a stressful event. So that's a trigger. Then what we see is as the child grows, there are some infections, recurring infections. You get them on antibiotics, they see multiple doctors, or they even have their tonsils removed, which is one of your first glands that protects you from infections. So your immune system is compromised. Then you go through life and everything, the infections get better for some reason after some time. And then you, in a woman, they have menstruating cycles starting at certain age, anywhere right now is anywhere between 9 and 16. And in boys is usually that maturation where they have the breaking of the voice, the testosterone begins to rise. So those are all stressful events, so they are triggers. Now, triggers can be something even like an injury, like you have a car accident and you actually fracture a leg. That's a triggering event. Mm-hmm. Yep. So all of these triggers create some changes in our body that ultimately leads us to illness or wellness. And we'll get into delve a little into how do you know what triggers are important and what are not important. So when we start this discussion with a patient, what do we really look for? We look at their, how did their life begin? Where did they come through a normal vaginal delivery where there was C-section? Why is that important? Normal vaginal delivery is usually the natural childbirth, and a lot of times the child is passing through the bacteria that the mother has in the vaginal tract. Whereas when you do a C-section, it's the bacteria of her skin and all the other people handling the baby at that time. So it's a completely different population of bacteria a child gets exposed to. So here's where why is that important? Because we've learned, despite all the cells we have 3 times the amount of bacteria that determine our health and wellness. So if you don't get the right kind of bacteria right from childhood, you start having problems like colic, recurring infections, or sometimes even anxiety as a child, depression as a child. So those are the very important things that we look at in your story. What is in your story that comes to us as a trigger, could it have triggered your very first trigger? Could that be responsible for your illness today? An example like for that would be a child that has pneumonia, a bad pneumonia, and has been on antibiotics for weeks together to overcome that pneumonia. Literally, when you give antibiotics, what do? You kill the bad bacteria, but you also kill a large amount of good bacteria. The child's immune system completely shifts and changes. And this is the child that's going to land up having eczema or even anxiety and depression later on because we have killed a lot of the good bacteria. So that's what a triggering event is. So that triggering event might be important. Whereas you fell off your bike and scraped your knee, that's a minor trigger unless that infection never healed. Or sometimes you'll find, this is a classic history for a cancer patient where they were biking, everything was fine, they fell off the bike, and since then their legs have been swollen, you get the sarcoma, and they'll say it was triggered off by a trauma. So again, triggering events can be important or they may not be significant at all.
That's why you have to ask the right questions, which I think is the difference between we know what questions to ask and what we're looking for.
Yeah.
To make that determination. Whereas normally when you go to a regular doctor, it's like, what happened last week, maybe.
They may not even ask that. They'll just ask, what are the diseases you have, right? Mm-hmm. What have you been diagnosed with? If you say you've not been diagnosed with anything, that ends your past medical. So what I think, and this is something we were discussing this morning, we said going to an illness doc to ask about wellness never gives you the right answer. Everybody says, oh, why isn't I can go to my doctor and they will be able to do this. They may know your story, but they don't know what to make of it. And I didn't know till I had the functional medical training how important the root cause of how somebody lives their life, whether it be emotional health or physical health or chemical health, how it impacts their cell functioning and creates that disease process. So you need to know how to listen to the story, how to gather information from that story, organize it in such a way that it gives you an explanation as to why you are where you are. Why do you have thyroid today? If pregnancy stimulates Hashimoto's or pregnancy stimulates low thyroid, every woman who's pregnant should have thyroid disorders. Why do some people have it and others don't? That's what your story tells us. And this is where a functional medical practitioner's approach or education puts them in a position where they do understand what all of this means, what this evolution means. Now, that's what we call as triggers. And a few more examples of triggers are, other than the infection and injury, are emotional experiences. If you're born in a family where both parents are substance users or abusers, or one parent is emotionally unstable, has anxiety and severe depression or schizoaffective, and you've been raised in that stressful environment, that is a huge trigger for you. And it really alters your cell function. And we don't realize that. And then you get exposed to chemical stressors, which we all are, or to physical stressors, and then it impacts how your health will evolve. You've heard people talk about what is your money story, what is your relationship story. So those are the things that we try to look at to see, is there something that in this that will help us dig and find out where we need to focus on. So adverse childhood experiences also impact how you're going to be living the rest of your life. And in fact, if you have a score of greater than 4, I think it's 0 to 10, and you have a greater than 4, you have more risk for chronic illnesses. How many physicians really have the time in their 15-minute slots to talk to you about your childhood when you're a 55-year-old man or a woman sitting in front of the doctor with a whole slew of problems? We barely have time to see if you're getting the standard recommended medications for your disease process. That's mm-hmm. all you get. And so when it always I'm always intrigued when people tell me that, I'm going to go to my doctor and have them do all these blood tests. Your disease is not simply about your blood test. Those are objective findings. But what kind of blood test do you need is based on your story and your subjective symptoms, right? And a lot of times you can say symptoms and say you have a headache, you get a pill. And in fact, I was talking to somebody this morning who was talking to me about his child's thyroid issues, and he said, we've been treating her for the thyroid, but what doctors generally say is, we'll see after about a year, we'll take off the medicine and see how she does. That to me is a trial and error. What is the science behind that? Do you know if a thyroid is working? Does she have a thyroid? Do they know why it's not working? If you don't have those answers, what is the point in trying different medications and saying, we'll try to take it off after some time? This is what happens to women. Women come in when they're pregnant, their TSH is high. They put them on a thyroid medicine because thyroid needs to be normal for you to have a normal pregnancy. But then they take them off the thyroid medicine because soon after pregnancy, the thyroid normal, only the TSH is normal, and they take them off and they never ever check it again. The woman may complain of weight gain. They'll say your TSH is fine. You don't have an issue. And this is why the story becomes important. How was your pregnancy? What was your life before pregnancy? How much stress did you have? All of this impacts your immune system, your general well-being. So gathering the story alone, when people fill our forms, what do they say? It took them 2 hours?
2 to 3. Yeah.
2 to 3 hours.
We ask a lot of questions.
Yeah, we ask a lot of questions. Some of them are repetitive. It's almost like a personality test to see are you lying or not, and if you can recall a lot of your events. But what we're looking for is the triggering events in your life that have altered your cell function that is causing your disease process, if that makes any sense. That's number one. Number two, once we get the story, we have to put it in a certain sequence for us to say, hey, where is the problem? Where am I seeing that the body is most affected? And this is where the genetic predisposition comes. What is your risk? So if, for instance, a person like me who has a family history of diabetes and thyroid, when I get stressed, my sugars are going to go up or my thyroid is going to fail. These are the two ways my body is going to respond because that is what my genetic material is. When you're stressed, this is what is going to happen. So we try to look at when our patients come in, what is their genetic story? What is their lifestyle telling me, and how do I approach it, and how do I put it into a recovery plan? How do I make that story irrelevant that they actually recover, if it makes any sense? The other thing that's very important about the story is, I'll give you a classic example of a morbidly obese person who comes to me, who's been happily married for about 35 years, has diabetes and a lot of other issues for which she decides she wants to take care of her health. But as we delve into the history, the one thing that she brings up, she says, I've never spoken about this after my childhood, is at the age of 9, I was molested. Now, why haven't you spoken about it? She said, when I brought it up to my near and dear people in the family, they said, oh, that's not a big deal.
Wow. Okay.
Right.
You need to warn me when you bring these things up.
Right. So, and
Wow,
I'm like,
crazy.
how much that impacts your whole life is something that very few people understand, right? And once they say it's not a big deal, you've just been told you're not significant enough. What happened to you is not significant enough.
That's the interesting thing too. Is I don't think I ever bought into this whole mind body thing years ago. And then once we started working here and just people say, oh, well, this thing started, these pains or whatever, this unknown disease process started. Okay, what happened during that time? It's always relationship, divorce, something huge happened.
Usually it's
and you
thought.
don't connect it.
Right. And I think I posted in one of our Instagram posts where the reason cells dysfunction is the 3 T's, right? Remember, toxins, trauma, and thoughts. So if your thoughts are very painful or they are toxic in any way, your cells are going to dysfunction. Trauma would be, you'll find people who would have an accident, their life will change after an accident, a motor vehicle accident, not because the accident caused it, their cells were not functioning well, and that was a trigger. And then, of course, toxins, which we are all exposed to on a daily basis with all kinds of chemical toxins, but some of us get diseases and others don't. I would say something like a nuclear reactor explosion, 100% of the people who are exposed to it should be affected. But not 100%, a good percentage of people are affected. What are the few that didn't get affected? What is unique to them? That's what we have to look at. So I think when you walk in saying, I have a problem, why can't you just do a test and give me a pill or tell me what I should eat? It's not as simple as that.
Right.
You really need to understand, how did you get to this point? What is the journey you made? What were the triggers? And then there's something called mediator. Now, a trigger is one event. It happened, a trauma happened. What is a mediator? A mediator is something that keeps that wound from not healing. So let me give you an example. Let's say you have an injury, you stub your toe, right? Once you stub your toe, then you put a Band-Aid over it. The next day you go stub the same toe. Happens all the time. They say the stub toe gets stubbed again. You'll find that the wound is much more painful, and it takes a little longer to heal. So if you keep hitting the same toe over and over again, you're going to have an injury. That's how calluses form. You'll find people who drive, they get the thickness because there's a constant stress in that area. So the body's way of protecting it is forming calluses. But triggers, like for instance, say you get married, that could be a good trigger or a bad trigger, right? But then if you have an unhappy marriage, that is what is called a mediator. That means it's mediating your inflammatory processes. You're constantly stressed. There's a lot of gut inflammation. You're staying in this relationship that doesn't make any sense to you. It's actually harming you emotionally. Or you stay in a job that's high stress, but you love the paycheck, you love the travel, but you just can't stand anything else that the job provides. So you're in a constant state of stress. That's what is called a mediation. So when you have a trigger and then you have something that keeps it going and keeps that inflammatory cycle going, a child that sees parents that are divorced and then has to live with the mother who has a depression and anxiety, that child has no time to recover from the trigger, which is the divorce, and emotionally being riled up by a mother who's not very stable. So those are all mediators. Now, what happens is that creates your story to where when you show up in my office with anxiety, depression, pain, irritable bowel, thyroid disorders, I have to look at that story because I got to detach you from your past, because today your life, the way it is based on how your cells are actually going to function without that past stresses. And also we need to repair them. So your story is extremely important, and you cannot go and seek wellness by just telling your symptoms. Because when a woman comes to me with anxiety, how many times have we seen anxiety as true anxiety?
And there's always some underlying factor.
There's usually something. And the minute they shift their diet, the minute they work with our life coach, the anxiety ceases to exist. Does that make sense? So we see it all the time. So it's very difficult for us to believe that people come in with anxiety, have a true underlying anxiety state, if I'm not addressing what's going on, what happened in their childhood or what is happening in their cells at this point. So we address a lot of the medical issues from different directions, not simply you got a memory loss or you have dementia. You got a memory loss. We got to see what are the few things that we need to look at that is creating the brain cells not to function, rather than just saying it's all about your diet or it's all about your stresses. It's everything. And they call it throwing the kitchen sink at somebody, right? We're throwing everything to get you better. And I think when it comes to survival, that's what happens, right? You do whatever is there within your capacity to recover. But it'll be so much easier if you know how you got there. If you know exactly how you got into trouble, once you have an idea, you can't use the same idea to get out of it. You have to use something different. But if you know the path that you came in, it's easy to create a path to get out. And I think that's another one of Einstein's sayings, right? You cannot solve a problem using the same methods you had to create it. I guess to solve a problem, you have to think a little differently. So the story helps us think a little differently as to how we have to approach your recovery process. And that's one of the advantages of going to a functional medical doctor. And that's one of the key things about, I think that's one of the biggest things that conventional medicine completely misses, because if 5 diabetics show up in my clinic in a conventional medical setting, all I'm doing is adjusting their medicines, checking their A1C, telling them to eat healthy, and I'm done.
It's the same process.
It's the same process, right? I'm just looking at those things. And then I send them to the nutrition coach who still tells them to count their carbs, they're chasing their sugars constantly. Mm-hmm. When we do a sliding scale, those of you who are diabetics will understand what a sliding scale is. You eat the food, you look at your sugars, and you give yourself extra insulin if it's too high, or you cut back on the insulin at the next dose if it's running low. It doesn't make sense. How can you keep chasing these things? Instead, when diabetics come to a functional medical office, as opposed to a conventional medical office, my question is, what is making you a diabetic? What are the things in your life? What are your unique stressors that is driving up your sugar? And once we get to their story and to their self-functioning, it is so much easier to resolve it, because really, we don't talk so much about medicines as much as we talk about the journey or the process in which we help them recover. If it makes sense.
Yeah, we spend a lot of time with people, which is
Yeah.
Very different from conventional medicine.
And, they need to have an understanding. I think most of our patients need to have an understanding what their blueprint tells them, number one. Number two, what is the journey that they made to get to the point that they have, and what is the journey they need to make in order to get out. And a lot of times people come and say, you'll do the test and you give me a diet, right? I wish it were as simple as that. A lot of times, even the regular diet we tell people to eat is so difficult for most people, because if your blueprint doesn't allow you to eat the way you've been eating now, for you to change that, it's like asking a smoker to give up cigarettes. It's like asking an alcoholic to give up alcohol, unless they have an understanding on the impact. If you look at any drug addict, any alcoholic, if you tell them what made you recover, they hit rock bottom. And unfortunately, most patients come to us when they hit rock bottom with their health. So one of the things I would say, the reason I wanted to do this podcast is having that notion, I have insurance, I can go to my doctor, is different than, it's just like how you wouldn't go to your cardiologist and talk to them about your knee pain. You don't go to your conventional medical doctor and say, can you do all these blood work, because this is what will tell me how my thyroid functions. They may do it, but they may not be able to tell you a story and help you understand how your thyroid got there. So try to seek, if you're really seeking wellness, seek a provider that actually is trained to look at the recovery of the body, recovery of your cell processes, rather than how do I manage this most effectively. Does that make sense?
And the other piece of that you had just mentioned too is their journey to disease and then their journey back to wellness. That's a huge part. You don't come to us looking for a medication or looking for this.
Looking for one solution.
Right. A cookie cutter solution is we really help you, walk you through how did you get here, because you're the one that's going to get yourself back. It's not us.
Yeah.
We'll help you along the way and give you the tools, but ultimately a wellness path is just that. It's a path.
It's a path. Yeah, it's not a point. It's not a point of, it's not a bunch of appointments. It's not like I'm going to go see my wellness doctor. If you've been seeing your wellness doctor for 3 years and still have the same issues over and over again, there's something really not working.
Right.
So we really try to look at your unique situation and then hone in. And sometimes it takes us a few months to get to what you may really need, because as you're walking is when we see what are the problems getting back to wellness, what are the stumbling blocks, because we clear the clutter and then look at with little more clarity where your problems are. And a lot of times I think when we change people's outlook to life, change some of their diet, some of their, how they hydrate themselves, by the time they get to that point where, I feel so much better, but I'm still not there, is when I can see, hey, this is what is in your way and this
Mhm.
is where we need to adjust. And sometimes it's hard when you don't have that guidance. And a lot of times I really liken medical care, good medical care, to good financial advice. And I was meeting with my financial advisor, and they do charge cash, and they are not based on commission. A lot of financial advisors are based on commission, which means they'll only sell the products that will give them the best commission. Or you can go to a tax accountant, you can go to a CPA, and get pay 200 here and there and just get everything for $1,000, but you get the basic. When you pay somebody to say, hey, look at my financial health and get me to this goal, and if they will do everything to get you to that goal, that's a more personalized approach. And that's what we do in medicine. We are your personalized wellness consultants who will get you to resolution rather than maintenance of disease. And for that, your story is extremely important. Without your story, um, there is no specific approach we can apply, saying, okay, these are the tests. It's not simply about, oh, let me just check your thyroid, because your thyroid doesn't function on its own. It functions with other things. The thyroid might be the only organ in your body that is waving the flag saying, hey, things are not right. Right? You have to look at it. It could be if you've only had a heart attack, and I have men who will come to me and say, I'm basically healthy, I've just had one stent. Well, your heart was waving the flag. Look deeper and see what is wrong. Why did that particular blood vessel get blocked? Look at all of the other metabolic factors to see how did the cholesterol get accumulated in that essential blood vessel, and you will find there's plaques and other blood vessels. And then we look at what are the stressors that is causing this accumulation. So hopefully having repeated it so many times, you understand how your story impacts your health and wellness. And going to your illness doc and asking for wellness is like going to your cardiologist and asking about your knee problems. I just think you're asking the wrong question to the wrong person. You're going to get the wrong answer. And the other part that I do want to say, some of us, I think this is another issue that we've noticed with some of our clients who will join our wellness practicing. The conventional medicine has completely failed me, and this is what I want to do. And then they get diagnosed with an abnormality, like, hey, we think you have early cancer somewhere. And suddenly the doctor who is diagnosed with them with the cancer, everything they say is very important. And you'll find many of the doctors will say, no, stop all your supplements, stop all this other things. Let's just take this stuff out of your body. And you get gripped by fear. You don't ask the question, do I really have cancer? Does it really need to be removed? What are my other options? It's like, oh God, just take everything out. Because again, you're just looking at one portion you're just looking at the problem, but you're not seeing how the problem evolved.
Mm-hmm.
Does that make sense? And a lot of times we tell people, whenever you get diagnosed, get a bad diagnosis, step back, look at why you have it. What are your other options? Understand how you got it, your journey, and therefore there's always, when you've made a journey to illness, there's always a journey to wellness. The question is, are you willing to make that journey, right?
Sounds good.
Are there any questions, guys? I know somebody is watching, but I don't know if there's anybody else. And many of you are just quiet and just listen to this. It'll be great if you guys participate and let us know and encourage us to continue to do these podcasts. Otherwise, you can always visit our website, holisticicon.com. And our Facebook page is Nisha Chellam, MD. And I think you would find this podcast later on iTunes. You have access to a lot of these things, I guess, on our Facebook page. And if there's anything else that helps you understand the functional medical process and why we do what we do, that'll be awesome. And also check our website as well as our Facebook page for our testimonials. Because one of the things that we do differently is our approach is to seek the wellness, how do you put it, to actually seek a solution to get you back to wellness rather than seeking a name for your condition.
Right. Mm-hmm.
Right? It's a little different. It's you can name anything you want. but I guess it's very important to understand why you have it and what can you do different about it. Anything else to wrap up, Marina, before we say
No,
goodbye?
I think that sounds good. My little food
Yes.
tidbit. We can do that if anybody has any questions in the meantime. You can go ahead and type them in. But today we can talk about sweet potatoes.
Oh,
Those are my favorite.
Versatile, the most versatile root vegetable.
So it is a root vegetable,
Yeah.
and I actually don't know that it's supposed to be in season right now.
It is.
It is in season.
Yes.
I thought there was a root vegetable that I was surprised that wasn't actually in season in the fall, but it is getting colder outside, so getting those like starchy root vegetables in definitely helps to keep you warm and fed throughout the winter months. But it's high in vitamin A, and a cool fact is it can actually be purple or orange fleshed, and the purple flesh actually has a lot more anti-inflammatory properties. So I guess the outside of it, and I have noticed this before, it'll be orange either way, so you don't actually know. Sometimes you have to
have it cut. Do they know, like, when the farmers should know that they are doing a purple
It's
or
probably
orange.
a variety, a specific variety, but it does look orange on the outside either way a lot of times.
Okay, that's
so you
tough.
cut it, it's purple.
Do you know the difference between the sweet potato and the yam? The Japanese yam, or?
I've heard different things. I don't remember specifically. Do you?
No, I do. I remember having read it, but there is a difference between the two. I think the Japanese yam is supposed to be a little better and less in sugar.
Less sweet.
And more fiber. But once again, it comes down to eat seasonal, eat regional. If sweet potatoes are in season, that would be a good thing to have. And it's such a versatile, starchy vegetable because you can make sweets with it and savory dishes with it. And it can be used even as noodles. And, you can put a sauce over it. So there's so many things. And it's fascinating to see when the way you cut a vegetable changes its taste. The tinier it is, the more tasty it is, but then you've broken it down and it cooks faster. And more big ones, I guess you mash and have it. It's very tasty. But this is one thing where you just add a dash of cinnamon and it's good to go.
Yeah,
right?
ginger's another good addition to it. The other interesting thing is, even though it's a starchy vegetable, it actually helps to reduce your blood sugars.
Yes, because of I don't know how those things work in a lot of these starchy vegetables. Why do some people have high blood sugars and others don't? So I would say one of the things that we do recommend, and when I should get down to doing this, is the continuous blood sugar monitoring. And I think for those of you who are diabetics, please monitor your blood sugar. But once again, it's very unique to you. Some people, sweet potato completely keeps their blood sugar flatline, and others it will raise it. You need to know your unique biochemistry. So I wouldn't give it as a blanket statement, all diabetics can have sweet potato, but you could potentially try and follow your blood sugars. Otherwise, get the continuous glucose monitoring. So as you eat, you can actually see your blood sugar levels and say, hey, is this a good food for me or not? So that's something to keep in mind.
Yeah, exactly.
All right. Well, thank you once again for joining us on our podcast on Wednesday afternoons. And we will continue to do the Transform Your Thyroid series. I will have a homeopathic doc on one of these podcasts. I'm very intrigued by the practice of homeopathy. And I will also try to get to you guys. When do you use homeopathy? What are the conditions it's the most useful in? And how do you know that it actually works? We'll get into that at one of the next 1 or 2 podcasts. I'm not sure when we can get our homeopathic doctor online. But thank you once again. And as always, please do support us by going on to holisticicon.com or subscribing to our iTunes and, of course, liking this page as well as liking our podcast. Thank you.